All right, okay. So thank you for that welcome, John and Rick. And then just a quick review of our kind of goals for today from the agenda. So I'm briefly going to discuss what we kind of gathered as a potential target population for this subsidy program based on the feedback we've gotten through the survey and through our prior meetings. And so welcome your feedback in that portion of the meeting on whether you think that looks like the right target population, if there's other eligibility criteria you would want to see reflected in who we're trying to target with this potential subsidy. Then I will share what we heard back from the survey responses that we sent out, and we got quite a kind of diversity of opinions there. I will try not to spend too much time on that, but just wanted to share back with the group what input we got. And then the big kind of portion of today's conversation is around subsidy program design options, and Mimi is going to lead that conversation. So she's going to share what we kind of have identified as 3 ways that we could deliver the subsidy, and then the advantages and disadvantages of each of those methods. And this is a continuation of what we were talking about previously. So we already kind of started this, but we wanted to expand on it. And I know we don't have specific time on the agenda for discussion, but we'll just plan to discuss each of these items as we go through them. So we are particularly interested in feedback from the group in the subsidy design options section on which of these designs, given the advantages and disadvantages, seems to you to be the most appropriate and appealing as a method of delivering the subsidy. And then lastly, we'll talk briefly about what the potential duration of the subsidy program could be and how we may want to think about that. And then public comment, and we'll kind of end next steps. So that's the plan for today. And with that, Mimi, I'll move on to the target population conversation. Oh, and just a note on what's to come over the next few meetings. So today, as I mentioned, we'll be talking about refining the program design in terms of that target population, subsidy design, and duration. We'll continue that conversation at our next meeting, and using the feedback we get today, we're going to try to hopefully continue to narrow in on a potential shape of this program and use that in the gap between now and our next meeting to come up with some high-level estimates around what kind of cost and impact we could expect for what the work group is thinking. And we'll discuss that at our next meeting. And then we're, running short on time, so I imagine we'll probably need that September 6th meeting to kind of hopefully be able to wrap up and have the group agree on what recommendations they want to put forward. So that's what's to come. All right, so target population. So to kind of think back to our last meeting, the group talked about what they want the goals of the program to be. And I think what I took away from that was that, broadly, the goal is to reduce the number of uninsured, and kind of in a more defined way, therefore, to target the subsidy at small employers most likely to have uninsured employees in order to reach that goal of reducing the number of uninsured. A kind of secondary input that we got from the group, and I think there was a little bit more diversity of opinion on this, so just putting this out there for discussion, is another goal would be to help employers get through a startup period, but not necessarily have a permanent subsidy for employers. But I think there was some differing of opinion on that one. So just acknowledging that. So given those goals, we laid out these potential criteria for the subsidy population. So to target the subsidy at employers with 2 to 9 employees who have not offered health insurance within the last 12 months. So we know those smaller employers are the least likely to offer insurance based on the survey data, census data we've seen. And if you're if you're limiting it to the employers that haven't offered insurance in the last 12 months, you're further shrinking that population into a potentially more manageable kind of target group, maybe stretching your subsidy dollars further to focus on those employers that aren't already offering insurance. And the group can discuss, thoughts on that and fairness, which I understand. Additionally, employers that have been in operation for less than 60 months or 5 years, so you're kind of looking at employers that are newer and in more of that startup phase. I think what we heard from the survey is there's an interest in requiring employers to contribute towards premium so that they have some skin in the game. And this will a bit depend also on the subsidy design model that the group is interested in, because this may not make sense necessarily in all of the subsidy design options. But if it does, that there would be that employer contribution. That 50% we kind of pulled out because that's the criteria for the federal small business health insurance tax credit. But the group could, discuss whether they think that's the correct percentage. And so some of these numbers are kind of placeholders. The group also discussed potential revenue and or employee income requirements. So one or both of these criteria to potentially target again towards the smaller, newer, less established employers, potentially with, a certain lower revenue or a certain lower average income. And then I think the years in business, that kind of echoes what C is getting at in terms of months in operation. So you can just kind of lump those together into some criteria around duration that the business has been in place. And then 2, that's kind of getting back to what I said around should there be some kind of employer contribution required. So this is, I think, our attempt to kind of shape the conversation for the group around a target population, but definitely open for discussion. So that's my piece, and I'll hand it over to John and Rick to facilitate the conversation from here.
So I think we have a question. I think it's Mr. Walters.
Correct. First, I want to make sure I understood what you said on revenue requirements. Can you repeat that one? And then I have other comments, but I want to make sure I understand that.
Yeah, so I think one of the suggestions that the group had raised was putting a cap on annual revenue and making that one of the eligibility criteria as sort of a further effort to target this at smaller employers. I think, the group could look at revenue or average income or neither, and just the employee and duration. So this is sort of a menu, I guess, of options that we heard and the group could kind of choose from as potential criteria.
Okay. Let me comment on several of these different points. I agree with the 2 to 9. No health insurance within the last 12 months reminds me of the argument that's going on right now about waiving student loan debt. And everybody who is currently paid off their loan or anything else is all mad that they're not eligible because they were good and they offered benefits in the past to their employees. Now they're going to get penalized. So that concerns me a lot, that issue there, because of an issue of fairness. I think you're pretty good, less than 60 months in operation, because we want it to be new. My next question that would confuse me some, employee income requirements less than 50,000. I'm sort of fine with that, but it adds a complexity that within a group of 5 people, 3 people might be eligible and 2 won't be eligible for it. So it'll make the administration that much more difficult for whoever's administering it, on or off the exchange. It'll be difficult because you'll have to annualize, and especially with salespeople who are paid a commission, it could get very difficult to do. I understand the purpose of it, and I sort of agree, but I'm just worrying about the problem of how that would work.
Yeah, and I suspect others have similar concerns. So up next is Glenn Arrington. Be sure to unmute.
Sorry about that. A little slow. Somebody's, my picture was right where somebody's information was. But anyway, I think the target population, and some of you are going to disagree with me, should be 2 to 50 employees because it's a small group product. I think the definition of the qualifiers will take care of itself, meaning the 2 to 9 employee group sizes will probably be the most of folks that would meet the eligibility criteria. However, when we talk about fairness, for someone who had started in business and watched their, paper clips, their pencils, and decided not to pay themselves as much salary, I'm concerned about the fact that if they have a bigger group of people that they start with potentially, or they have a larger group of people that aren't being paid as much, those people are going to feel penalized as well, like Sandy was saying, because they did spend the time to figure out their budgets and implement and launch their companies. So I think that, again, I'm going to kind of go right to the end of the model. The New Hampshire the New Mexico model and the Maine model did not exclude any employer size between a certain niche. Everybody was eligible. And I think it'll take care of itself based on income. So some of those employers, as long as they meet the definitions. The other thing I have a little concern about, contribution minimums of 50% towards a premium. In Maryland small group, there is no regulation that is required to participate in premium. Now, I know we're going to be giving subsidies, but again, it'll exclude those people most likely that aren't contributing because they'll go to the sub, to the exchanges with individual products potentially. But I just think that we have to try to follow the models of small group currently as it's existing. I'm good with the idea of revenue requirements and income requirements. And my thought process was to have 3 buckets with the New Hampshire model, potentially 3%, 6%, 10%, depending upon income charts. And I know I'm covering a lot of territory here, but it does kind of encompass this whole target population. And the target population should be the uninsured population. And that could be groups of 20 to 30 employees. I have groups that are 15, 20 employees total, only maybe 9. And by the way, on average, Aetna, I was talking to Aetna, the average enrollment size is 8 enrolled. And where I'm going with that is you may find that some of these employer groups that have 8 or 9 enrolled, they may have 12 or 15 employees that are eligible. And when you get the waivers that are legitimate waivers, and then you always will have 1 or 2 people that just won't want Medicaid, that doesn't cost them anything, or they don't want to pay on the exchange $20 or $30 or $40. They just don't want to pay for health insurance. So my, I guess, initial statement to this is I think the target population should be all employers 2 to 50, and the parameters will take care of itself when you're going to give subsidies to be fair and equitable to all. And I'll just leave that comment as my first statement.
Thanks, Glenn. And what I'd urge everybody is we're not looking to make a compelling argument to sway the group initially. So what we want to do is, as Glenn did, state the concerns or ideas as opposed to lobbying for a particular answer. So Trina, you're up next.
Thank you. Thank you, Rick. I'll be as brief as possible. I think with each letter, there's going to need to be a verification process. And so the more restrictions that we have, I just want the group to remember that those items are going to need to be verified. And so oftentimes with verification, you have extra red tape. The other thing that I wanted to mention is, do we really want to have the same program that we had before? A lot of the items on this list is what the original shop, contained. So especially the employee, the employer would contribute 50% towards the premium. So my question is, did that work before? And do we really want to continue to go around the same mountain that we've all, do we want to construct the same program that we had before that didn't work? I yield.
Amber, hi.
Hi there. I was just going to mention the same thing. I mean, certainly the contribution of 50% is what I feel is not working on the current shop exchange. When I'm talking to employers, that's kind of the first thing that knocks it out and makes it not an option. So I definitely think that would be a deterrent. I think that's part of why the shop is not working currently. And then also the group size as well, 2 to 9. I would recommend if we do start something with the 2 to 9 that it has an extension for growth. So prior to the shop with the Maryland Partnership Program, it did extend to 25. You could renew into 25. So I thought that was a good idea. And then also wanted to mention with the employee income requirements, with the Maryland Partnership Program, we took an average salary versus each individual income having to be under 50,000. So that did kind of make it a broad, it really helped to be able to take that income average, and then that would determine the subsidy level, and then it would apply to each individual employee. So I think that worked really, really well. And that's kind of all I have. Thanks.
Thanks
Wow.
for that feedback, Amber. Thanks for that feedback.
You're welcome.
Hey, thanks for having me. Rob Matson, Care First. I'm stepping in for Deb, so I'll do my best impression of her today for those of you that I think probably know her. What I'm hearing is sort of a theme through some of the commentary, some really good points and sort of questions. And one of the things that comes to mind for me first is actually the administration, right? Kind of the how to make this happen. And when you have all of these parameters, they're great concepts. I just wonder, how can this be actually implemented and administered? None of these are pieces of information that the health insurer currently has. So as I look at the 2 states that have small business subsidy programs, one of them, right, has just a flat rate reduction, and the other has a flat PMPM reduction. And I think the reason I don't operate in those states, so I don't know anything about them specifically, but I suspect part of the reason they did that is because that really simplifies the administration and the carrier systems. What you essentially do is you just reduce rates by a flat amount, and then that's already loaded in. So if you do a program, and I'm not necessarily trying to say that we shouldn't go in some of these directions, but if we do want to go in some of these directions, I think we actually have to start to look at the how as well, because we don't know any of this information. So I think you'd have to set up a separate application process. I assume that would have to be administered by the MHBE. And I understand the current, there was reference made to the current tax credit that exists. Recognize that is a back-end tax credit, right? I think the concept here is to make this advanceable. And so if you want all of that work to happen before enrollment, you've got a series of steps to get there and a series of hurdles that have to be, I think, cleared. But I apologize. I know I'm coming kind of into this mid-conversation. So if there's any nuance here that I may have missed or any pieces of how we're considering doing this, but unlike the individual market where there is an exchange platform that does all that sort of consideration in advance, that doesn't exist today on the small group side.
Right, Rob, you bring up some very good points there about the administrative connection on this. We've had some thoughts on it, but nothing concrete. We're still kind of in the crawl phase of all this. But if you could do it as sort of a qualification through application, and then that gets applied to a billing mechanism in some sort of way as a standard, that would simplify some things. But we're back still trying to determine things that would go into the qualification standard, I believe.
For a question for Rebecca, Johanna, and Mimi, are we going to capture the chat? There's a really interesting conversation going on relative to income requirements at 75 versus 50, as well as some other sort of framework dialogue. So I just want to make sure we don't lose that. And Glenn has his hand raised.
Good one, Glenn.
Okay, so just to comment to what Amber said, you also take out S Corp owners, 2% shareholders, and the owners of the organization out of that value for the shop, the way it's set up currently. But I kind of agree with the Care First representative who spoke that the more parameters that we put in place here to structure, to adhere to audit, the more challenging to implement the program, which is basically to get the uninsured population insured in a small group and provide subsidies to all of those small employer groups that could not afford it. And I think that if we stick with the small group, we went through healthcare reform in 1994 and created a lot of these regulations, and a lot of them still exist today. And based on the contribution minimums of 50% towards the premium, I agree with Amber as well. That's not in small group. And I have some clients that have bought the product and they don't contribute anything towards the premium. It's rare, but it's high income earning companies that do that. So I think now with subsidies, it's going to be lower income people, but to have the employer have to ante up 50%, it's going to be a deterrent and kind of take away from, I think, what the goal is here. So that's my comment on that and that thought process.
Thanks, Glenn. Amber.
Hi, thanks. So I just kind of wanted to make a recommendation with it as well. I know we're trying to combine, it almost seems like we're trying to combine the two programs together and maybe pick the best of each one. But I did want to stress, just from working with the Maryland Partnership Program so much and seeing how successful it really was a successful program. And the only reason that it went away was with ACA. There was so much participation. And I have tried exhaustively to try to get groups into the shop. And I think that it is, like Glenn said, and a couple others have said, with the requirements, the companies feel like there's so much paperwork, there's so many hoops to jump through. And really, us as brokers can say we really cater to our clients. I mean, we basically do everything. If they could have us fill out every piece of paperwork, they would. So I would just make a recommendation that we try to model this program as closely to the Maryland Partnership Program as we can, versus trying to add in some of the shop items. That would be my recommendation.
Okay.
And sorry, can I just jump in there with a follow-up question for Amber? So given that the standards around the prior partnership program to align, it seems like the standards in that program limited the size of the group, and there were income requirements that affected your subsidy eligibility. Those, I recall, were the two main eligibility criteria. Am I thinking about that right?
Yeah, are you asking me?
Yep.
Yes. Yes. So that was included. Yes, that was included, and that was a good idea. The only difference would be is the income. I'm sorry, I'm having some technical difficulties here. I'm having computer issues, was the income was an average versus an individual income. And there was a group size limit, but you had the opportunity to enroll when you renew up to 25 employees. So I think that that would be great. I think that the main thing that I was saying is that 50% contribution was not a part of it. And I think that that's part of why the shop is not successful.
Okay. I think we should proceed because we're eating up our time and we got a long ways to go. A lot of interesting discussion ahead. But all that was great feedback, good ideas.
All right, I'm going to try to discuss this survey responses very briefly because I want to get on to the other portions of the conversation. So I think we saw in many of these, we saw a spread in answers. So we saw that people kind of liked all of the goals. They liked reducing costs for current businesses. They liked reducing the number of uninsured, whether that's through small group or through individual. So not a clear leader among all of those goals. The next slide, Mimi, I think goes over our next question. Yeah, so then we had some just, we shared just the write-in responses we got on this. I won't go into these, but you can look over them if you're curious. Next slide. And then just some more written feedback that we got on program goals, expressing a desire, I think, as I sort of said, to try to do all of the above with the program to make sure that businesses don't get worse off, that it supports their efforts to recruit employees and make coverage accessible. Yes, all right. So in terms of who should be eligible, again, we saw a mixed support here, kind of some support, but not overwhelming support for any particular one of these criteria. Employee income requirement getting the most positive responses as a potential criteria, eligibility criteria. And then written responses here, again, I won't go over each of them, but you can review them if you're curious to see that more detailed feedback. And then in terms of whether the subsidy should be available on and off exchange, I would say this is one response where we did get kind of a more consensus from the group, being that, I think about 60% of folks that said it should be available both on and off exchange, about 2/3, I guess, of respondents. In terms of how the subsidy should be designed, again, our responses were kind of all over the place in terms of whether we should do a kind of a fixed percent off, a fixed dollar amount off, or a subsidy through the individual market for small employers, employees. So not a definitive answer here. We're going to be talking about this more today. Next slide. We can continue on. And then in terms of whether there should be a employer contribution, again, we got, yes, I'd say the majority of folks here said no, we should not require an employer contribution. So I think that is consistent with the conversation we just heard. Oh, actually, I reversed that. No, yeah. I'm misreading my colors. A majority said yes, an employer contribution should be required. So that is not consistent with the conversation we just heard. So I think that brings up that there's differing viewpoints on that. So yeah, that will, I suppose, need to be a continued item of conversation. Sandy, you had a question?
I was just gonna say, maybe the point was that 50% isn't the right number. It might be a lower number, believing there's a
Yeah.
contribution. But 50,
Yeah.
some people might feel is too high.
Yeah. That's a good suggestion. And then regarding the question of whether savings should be passed on to employees, people sort of, we had a lot of kind of other responses where people entered their own thoughts on this. The largest group said yes, savings should be required to be passed on to employees. That was about a third, 20%. And I'd say about a third said no, just either no or no. And if you have an employer contribution requirement, that's enough. So some mixed feedback there. Here again, about a third said no, minimum participation should not be required. And then we got about 30% that said yes, some level of minimum employee participation makes sense. So that was the survey responses. Glenn?
Yeah, Glenn has his hand raised.
Yeah, in response to the giving money back to the employees based on their contribution level, with the ACA, there's the medical loss ratio. Some of you may be familiar with. It's 80% small group, 85% large group, and the employer is required to provide that percentage back to the employees. And I think that is the right thing to do. Just wanted to add that as a comment.
Thank you. And so I guess I would say just maybe as to wrap up this target population and conversation as we move on into the more of the subsidy design. I think we've gotten a lot of feedback, but not necessarily a clear consensus from the group. So Mimi and I will plan to follow up with John and Rick on kind of how to move forward, whether we try to model a couple of different options for target population or maybe try to do another survey to get more kind of input from the group. But we'll talk to John and Rick about that, and you'll be hearing more from us. So with that, I'll hand it over to Mimi.
All right, thank you, Johanna. Hopefully you guys can all hear me. I'm going to be going over the subsidy program design options. So we've kind of formed 3 options as far as what a program, a potential design would look like. And so the first option is a traditional small group employer sponsored plan. And what a potential design for that would look like is basically an employer would apply for, and a subsidy would be set at a certain amount, at a certain percentage amount. And based on the New Mexico model or another model. And with that could be 10%, it could be 20%. It just depends on what the budget looks like. But the employer would be then determined eligible through the application established by Maryland Health Benefit Exchange. And it could be administered by MHBE or a third-party administrator. And then once the employer is determined eligible, the employer would set up the employer-sponsored plan. And then that employer would then claim the subsidy for either 12 months or 12 consecutive months. And this is just an option. It's just something that we said, this is what it would potentially look like. And we would love your feedback on this. So, and then this could be claimed again, the employer could claim this upfront on a monthly basis, on a quarterly basis. It could be applied directly to their invoice. The employer would have the option of passing the credit, a full portion of the credit or part of the credit to the employees. And then we could consider as well as like a tax abatement, some type of payroll tax deduction some other tax incentive based on, kind of inspired by the current shop tax credit. But I can see that in other discussions that the shop tax credit hasn't been that popular. So, and then it goes on to continue to say, this option would be, again, available in the current environment. You know, there's an open enrollment season, which is November 15 to December 15, and which allows waiver of participation rules. Or it can, and in the current environment, any month, you know, small groups can apply at any month, and but they would be subject to that participation rules. And then, you know, we can increase the subsidy as criteria are met, such as like the smaller the business, the bigger the credit, and then we can keep the requirements the same as shop tax credit, but then I'll take that back because I know that's not very popular. So any questions on option 1 so far, or any suggestions?
Trina.
I wouldn't use the word popular for shop, because it really, for the small business, it really does boil down to money. You know, it boils down to what that business can afford. And it's not a matter of popular, but it's a matter of how much money can that small business employer afford to contribute to the premium. I yield.
Thank you for that, Trina. And that's a very good point. And Rob, you have your hand raised.
Yeah, I just have a question. I'm sorry. So this is for this option you're talking about an advanceable subsidy, or you also said something about a tax credit, and so they're just different. I'm just trying to understand what this one would entail.
So this is a tax credit. Well, what I'm envisioning is that with this sponsor, the subsidy would be kind of like in addition to the shop tax credit. So for example, if there's a business that is currently, let's say it's a shop group, let's say it's a small business that has a plan on shop, on the small business exchange, it would, in addition to that, can claim additional tax abatements or tax incentives as part of the subsidy.
And let me just also jump in there, sorry, quickly, Rob. And I think what we're trying to suggest is overall, this idea is use traditional small group plans to provide a subsidy. That subsidy could be just a credit, a discount on your monthly invoice, kind of like a very simple to conceive of subsidy. Alternatively, it could potentially, the group could recommend some kind of tax credit rather than that just kind of straight monthly deduction, similar to what is available federally. But I think we've heard a lot of concerns with the tax credit idea and a lot of appeal to the monthly subsidy because that addresses cash flow problems. But we wanted to put it out there as those are two ways that money could be given to small businesses.
Glenn,
yeah, I think where I'm going with that is just if it's going to be advanceable, we'd probably want to talk through the flow, because what I'm unsure of, right, is so you, from like a consumer perspective with this concept, you're starting with the MHBE and then you want to enroll with the carrier separately. So there's a connection point, like, so you've applied to the MHBE to get a tax credit, but are you signaling to the MHBE who the carrier is? How's the MHBE sending it? Right. So that's the kind of sets of information and the administration questions that I sort of start to come to mind, because we want to make sure that this, I think one of the most important pieces to this from my perspective is to make sure that it's something that functions effectively for small employers, so the money gets to them, you know, in an efficient way and doesn't present any additional hurdles. And so, sorry if I'm being sort of annoying about these sets of points, but just sort of that process flow would be important to, I think for us to consider with this particular option.
Yeah.
Absolutely. One of the things we discussed is that the employer gets somewhat of a voucher. So when they're setting up their group plan, it says that they would qualify for a 10% reduction in premiums in some formula way that was established, and that would be set up at the billing so that there's a line taken off. It says minus 10% or minus $56 or whatever that would be according to the premium. Now that leaves you looking for that additional money that would come from the state. That's the subsidy portion that would come to you from the state. So it's almost like you got to give a credit to get reimbursed from the state to make you whole. But we're open certainly to other ideas in terms of how that might work.
Right.
Yeah, that all functions on the individual side through like a complicated set of technical EDI transactions. And so with those not existing on the small group side, we just want to carefully think through how to make that, all those pieces, those are a lot of different pieces that have to tick and tie together. And it's actually can be fairly complicated from a technical side. So I just
right. Rob, I was going to say that was my big concern going from a individual that you're dealing with, one individual getting the immediate tax credit, and you being meaning the carrier being able to apply the credit. The federal government gives the credit of money back to you. This would just be the state doing it at a group level. And yes, that would be complicated. A lot of EDI transfer groups, people coming on, coming off the plan. But I think simplicity, I like, the idea of you wanting to add some additional potential tax benefit. But I think if we keep it simple and not try to add the tax on the back end, like everybody's been saying, and just provide the tax credit upfront in a form of a premium reduction. And if we have maybe 3 different buckets, whatever those buckets are for the criteria of income for those groups, and then put them on percentages that the state can manage as far as how much money are we going to need. And I've already done some estimates in my mind of what it would take at 10% of 100,000 uninsured at a $550 a month premium. You're talking $55 million. So, if you scale back the higher income businesses to maybe a 3% or a 4% instead of 10, and some of the ones in the need get a little bit more, then you got a couple different buckets to substantiate the money to distribute. But I think it has to be clean and upfront, or it's not going to work.
Sandy?
Yeah. My question is number 4 here. Are we stating that the subsidy is only good for 12 or 24 months, or
It's just an option. It's just a suggested option. We can work with different timelines.
I just wonder, because I think that's one of the things that also hurt the tax credit also. It's limited length. The other thing that's important that really happened over the weekend is the 3-year extension on the subsidy in the individual marketplace. So for this to be competitive, especially in that small group place, you're going to have to offer an extremely rich plan, I think, to equal what's happening on the individual marketplace. So we have to think, we might be talking about this now, but it really might be a program for 3 years from now if the federal subsidy goes away. Because right now, since that's continuing for another 3 years, there might be a much better option for a lot of these small employers and their employees to all be in the individual market.
Dave Brock.
Yeah, I was just wanting to comment on sort of going back to Rob and Glenn's conversation on, I suggest we take the word tax out of the conversations, because that's something we just, at least from a carrier perspective, we just definitely don't get involved with the taxes between the client and whatever government body or agency is involved. But going like to the partnership, to your point, John, that's how the old partnership pre-2014 worked. Is you had a certain subsidy, they had that subsidy amount, and the carriers got that subsidy payment directly from the state. So that's for y'all get back to simplification, like Glenn is always saying, that's really probably the most feasible, and from an operational and administrative perspective, that's really, at least definitely from the carrier standpoint, everybody, that's really what is probably, again, most efficient.
Amber,
Thanks, Deb.
go ahead, Amber. Got unmute.
Oh, thank you. Yeah, so I was just going to piggyback on that as well. I think as streamlined and as easy as we can make it, because you have to figure, us as brokers, we're on the marketing side as well. And you only get a couple minutes to talk to someone. I mean, think about it. When you're at work and you have someone call you on the phone and you're trying to getting to the person who handles the benefits is enough, even in a small employer, because they are screening calls coming in. So you have to make it easy, quick. This is this new subsidy program. Take a look at this. You can get up to so much of a credit. It can help your employees. You don't have a lot of time as soon as you start adding in all these, if you're this, it's 10%. If you're that, it's this percent, and then you can get a tax credit. And as soon as you start rambling about all the other little details, you lose that person immediately. So, and again, I've been in this industry since 2000. And we would sit and just make calls. Glenn can tell you at Optimum Choice, we had what were called blitz days, where we would just sit on the phone and just make back to back calls. And you can make 20 calls in, 15 minutes. So just as soon as you get someone on the phone, I feel like marketing piece is a big part of it as well. So I think that just keeping that in mind, keeping it as simple, streamlined as possible. If your average income for your company is this, you can get up to this amount, and it's paid directly to the carrier, and it just keeps it easy and attractive. So I just wanted to add that. Thank you.
All right, thank you all. I'm gonna keep going because we have about 12 more slides to go here. So,
Yeah.
All right. So the advantages and disadvantages, I won't touch on everything, but I'll say that just comparing what the advantages of offering this plan is versus the disadvantages is that, the employer selects one plan design or multiple plan designs, and it's strictly up to the employer to, and the employees have limited selection, especially if the employee is coming in after the plan has already been established. They literally just have to select whatever the employer has put up in front of them. And then, there is a value add to small business plans versus individual plans, such as wellness incentives. There's a network availability as well on small group plans versus individual plans. And then employees do lose APTC, the advanced premium tax credits, if they have an offer of affordable employer coverage. So these are some of the top things that I think, are some of the advantages and disadvantages of these plans. And I'll...
Right. One quick note, just in terms of key advantage, is the employer gets the credit for offering the plan to employees. That's huge. That's a real driver for employers.
Yes. So option 2 here is the subsidized ICRA plans offered by small businesses. And this is a potential design, again, set up similar to what we said option 1 is, where there's a set dollar amount or a percentage amount of the employee's premium. And again, this could include the employee's family. And then the second step would be the employer would be determined eligible through an application that would be administered by MHP or a TPA. And then upon determination of that eligibility, the employer will set up an HRA, their employer-sponsored HRA for those employees. Again, yeah.
I'll just jump in, and then the final step, which we didn't spell out here, but then of course, the employee would use that HRA money to buy a plan on the individual market to kind of bring us full circle.
Right. Well, yeah, that was going to be next. So they would claim that subsidy for, again, X amount of months. And then this would also be either could be directly applied to their invoice, or they can pass it down to the employee. We can take out, again, the section C where the tax conversation, we're going to just eliminate that. And then it's basically the same. The main difference here is that in option 1 and 2, employers can set up a plan during open enrollment season or any time of the month, any month of the year, that is. So go ahead. Someone has.
Trina, go ahead.
Okay.
And so then what happens after 24 months? It just ends?
It depends. Well, I'll let John or Rick.
So that's a great question. I mean, anytime you're dealing with a subsidy, you're dealing with an artificial marketplace that's subject to budgets and the like. Even in the first option, you would almost have to consider it as a bootstrap program for businesses getting started, that you're going to give them a leg up for 24 months and then that bird has to fly. That may be not possible, or it may be renewable, but that becomes a funding issue. Can you fund a subsidy for an employer indefinitely? I don't think the political environment allows for that, but.
And so that goes back to, my original comment is, are we going to keep going around the same mountain, for 40 years? Because it's certainly, ending the subsidy is it's a discouragement to joining in the first place. So that's just my 2 cents.
Sandy, go ahead.
Well, I think, as I said, I think at our last meeting, I think the subsidy does have to end, but I think it should be phased out. So if at the end of a year, 2 years, whatever it is, then the subsidy becomes 75%, then 50%, then 25%, and it goes away. That allows that business that's growing to take it in small steps to end up getting there. Because I think if you're going to pull it out 100% after 2 years, we are going to have a bad effect. But if we can slowly wean that person off the subsidy, I think we're in much better shape. And maybe it's after the first year you start weaning. I don't know. But I think that's a better approach than totally eliminating it.
Good feedback.
I think it's also important to say that some of these options can be offered side by side. For example, we can have traditional small group plans as well as the ICRA plan side by side, and have it work that way, have it designed that way. So I just wanted to point that out as an option.
Glenn, go ahead.
Did I misunderstand? Did I misunderstand something there? The ICRA plan, the individual consumer health reimbursement plans, they're not group set up plans where when you hire a new employee and you are set up, let's say you set the policy up in April, and now you have a new hire that's in the first of the month following 60 days, first of the month, following 30 days. You have to have a group policy in force. You can't have an individual policy with an HRA wrap around it and provide money because they can only enroll during the open enrollment in January. Am I misunderstanding something here about that? Because if so, I stand to be corrected. But I'm under the impression we're trying to get small group policies to be the small employer vehicle, and you can set them up at any time during the year. But when you buy an individual policy and have to put an HRA product in there, you can't do that. If I'm missing something, please correct me.
Maybe I can take that one. So I will double check this, but I believe that a new offer of an individual coverage HRA qualifies you for an SCP in the individual market. So if an employer sets up ICRAs for their employees and then they hire in April, that person newly has access to that ICRA, so they can enroll in the individual market, at off cycle. You're shaking your head, Glenn.
I have not seen that. So if that's something going on, that's news to me.
Okay.
Sandy, you have your hand up.
Yes, I don't think you could end up having people in ICRA in the small group plan if there are any participation requirements. I think you'd have to choose, a group would have to choose option 1 or option 2. I don't think they could meld those two options.
That's right.
There'd be certain conflicts.
Mhm.
No, you're correct, Sandy. My comment was saying that, both options can exist and a small group can choose one or the
One
other.
or the other.
Mhm.
Before we move on, I felt like I cut Trina off. Trina, you had another point you were either going to make or ask a clarifying question.
Thank you, Rick. I never mind. Thank you.
Okay. So one thing I guess I would say is, I know we're struggling about the idea of a term on the subsidy or termination on the subsidy. We've at least got to agree on the framework of options that can be costed out before we get on in a later meeting to the conversation about what the budget would look like. So that's why, I know many of you aren't comfortable. I've been seeing the chat comments about this concept of how we terminate 12 or 24 consecutive months, but we won't be able to get our hands around what the cost would look like for the amount of subsidy we'd be asking the General Assembly for without some of these questions being answered.
Right, and based on your feedback, we can alter. We can change some of these guidelines and some of these designs. These are, again, just suggestions, and based on your feedback, we'll definitely continue to work on it and refine it.
Mhm.
So again, option 2, I won't go into every bullet point here, but these are ICRA offered by small businesses and the advantages and disadvantages. Again, the advantages are employer can determine contribution amounts by different classes. There's about, I think, like a list of 11 different classes that they can classify their employees with, and then it's definitely less expensive than traditional small group rates because the individual would be going off to the individual market to shop for plans, and then this is more flexible for employers and the employees. The employees gain control over the plan selections, and then the disadvantages are obviously if there's a group that's interested in any type of tax credit, they wouldn't be eligible for the shop tax credit. The employees will lose advanced premium tax credits if the employer's offer is more affordable. And then this is not available for self-employed individuals. And again, this is a limited provider network out of area coverage. And then there's definitely way more education and marketing efforts towards small businesses to take up something like this. Again, there's option 3, but before I go on, was there anything else about option 2 anyone wanted to talk about?
Go ahead, Dave.
Hey, Mimi, so let me ask you before you go on to option 3, if you would. I saw throughout option 1 and option 2, I see, obviously the use of third-party administrator language.
Yeah.
And while we do have, yes, the great Sandy Walters on from Kelly Benefits, I mean, unless he's speaking for all of TPA, I assume we're talking about Kelly, Benefit Mall, Amwins, normal third-party administrators in the market.
Right.
Are we sure that, I know we got Sandy for Kelly, but again, Sandy, unless you're speaking for Benefit Mall and Amwins, are we sure they're on the other two are on the same page and with buy-in to all of this? I'm just wondering if we do exchange it to the off exchange market where the TPAs constitute an overwhelming majority of the small employer clients as their enrollment and billing administrator. Do we? I mean, have we included the other TPAs in on this conversation?
I don't think we can conclude until we know exactly what the plan is, but I know that they all would be interested in doing it as long as it becomes feasible and all. I know we are, and I know Benefit Law is, even though it was just purchased. And I don't think that will change anything.
Right.
I think they will still be involved and interested in doing it because they were very interested at the beginning in administering the shop. In fact, they became, when it was 3 players down to 1 player, they became the player and still did it. So as long as it could be both ways, I think we're already integrated with all the carriers and everything else. It just becomes some of that upfront eligibility stuff. How much of that would be done at the exchange level or at the TPA level, we'll have to see. The way the tax credit was done, it ended up being done at the exchange, and then you could go the other way. So we'll have to see. But I believe so.
Thank you, Sandy.
Yeah, Glenn added to the chat that if it's easy, it's going to sell. But easy is a big part of this discussion. Stephanie, you have your hand up.
Yeah, thanks. I think for both option 1 and 2, I just want to raise up the fact that there are some folks who might already be getting coverage through the individual market who are very low income. And so I see APTC is listed here, but there's also the CSR reductions. And so, that might also be a loss for both of those ideas. But I'm not positive. I mean, I assume that people for option 2 would also lose the CSR if they had an ICRA.
That's correct. Yeah, they lose eligibility for all federal assistance.
Okay. So I just wanted to point that out. And then also for option 1, if they're getting coverage through the individual market, I see that they would lose APTC, but I also want to bring up that if folks already have a plan on the individual market, then it's possible they could lose more than just APTC if they're with a certain carrier or there's something else attractive about that plan that the employer plan may or may not have. Just trying to keep in the back of my mind the thought of unintended consequences.
Glenn, go ahead.
Yeah, I was going to say if there's an upside on the third-party administration side, meaning, ease of implementation, but also providing that service, it goes a long way. It just, unfortunately, the shop, the way it was designed, and I think we're all agreeing on that it was too difficult to implement. As Amber said, sometimes I'd spend, 20, 30 minutes on the phone just to find out if they'd even qualify and explaining everything. So, it does get back to the basics of what's the easiest way to do this to provide the goal, which is to get the uninsured population at a fair premium. And I guess to your comment you just made about the carriers do offer the same products on and off the exchanges, but it is true that the reduced deductibles that they receive the abbreviation I just lost it, but that the deductible reduction, the CSRs, are definitely not on the group marketplace. You're not going to have, they would lose that. But on the upside, they potentially are going to get the benefits of in some cases, there's not a platinum plan, not that many people would buy it, but there are some upsides to the policies that are, that are out there, depending on how this is formulated. But anyway, that's my comment.
Trina.
I just want to clarify what Stephanie said and just, get on that bandwagon. I just can't conceive the letting my current clients who I know could be my current business owners and current companies that I have, they don't have group policies because a large part of their employee income base is subsidy level. So I just can't conceive me going to them and selling this saying, hey, you guys can go to shop. It's just the unintended consequences that Stephanie outlined is very real. And so designing a product that is competing with federal subsidy, I just don't think we should design something that's in competition with federal subsidy. I think we should design something that works together with federal subsidy.
Sandy.
I think that's why I said before, this is going to be very hard to do in the next 3 years because of competing in the individual marketplace today. It's just gotten to be a much richer program for a longer stable period. And it's going to be difficult for whatever we do, and unless we make a massive investment here, it's going to be very difficult to move many people because the individual marketplace is now priced so low for those people who are less than 2 times the poverty level to be getting benefits. I agree with you, Katrina. We could be hurting an employer by making them take a plan. Their employees will be hurt and disadvantaged because I'm doing the right thing by giving them insurance. I'm going to actually hurt them. And I sure don't want to do that. Again, I'm a great employer. I'm now going to give you health insurance and I've hurt you.
So it's either go big or go home. You know, why continue going around the same mountain, you know, every year? And so I just and that is why in the beginning of the process I said, why can't we just come up with a set of, you know what rules and regulations the money is there. We know that the money is there because the individual market is have the money. And so my question is, how do we tap into the existing individual market? And in my mind, I mean, I could be dumb, please excuse my ignorance. In my mind, I'm thinking design regulation so that if someone wants, if a business owner wants to offer subsidy and also have that employee keep their subsidy, keep the federal subsidy. So I mean, I know you guys have been doing this way longer than me. You know, I recognize that, and so I just think that you know we should design regulation that works where the federal government will allow us to work with them as opposed to compete with it.
Glenn.
There are some obvious good points being made here about the things that would be taken away in the individual market. But on the flip side, one of the big advantages that sometimes I talk to people about is the prescription card in the group marketplace is better than the individual marketplace. And we can't change the carriers how they filed the plans. I mean, we could put in what do we want to do to regulate those types of policies? But when you go into that individual market, everything applies to the deductible mostly, except for generic drug card. And in the group marketplace, you can buy products where you could actually, somebody who was having to pay out of pocket for their pharmacy benefit, potentially, now they're going to get a benefit where they get first dollar coverage if they pick a plan that's a little better. So there are some positives and negatives both ways on that. I don't want to discount that as an option.
Stephanie.
Yeah, just briefly, Glenn, that's a really good point. Prescription drugs are really important for people to be able to access. Since I'm wearing 2 hats and I'm on the affordability work group that the exchange is convening, I just want to raise up that there has been talk in that work group about standardizing prescription drug benefits and especially generics with new standard plans in the individual market. I don't know if then they would be comparable to the group or not, but just as an FYI, since I heard that conversation recently.
Good point. Okay, Mimi, I think we can move on to the third option.
All right, third option. Okay, so the third option here is additional state premium subsidy. So this is basically where the employer, again, will be determined eligible through an application administered by MHPE, most likely. And we didn't put TPAs here just because we didn't know if it would be feasible, but it may be. So maybe additionally TPAs to determine employer to be eligible for this. And then upon that determination of eligibility, the employer is associated with some type of a unique code or a discount code, if you will, and that will identify themselves as eligible for a subsidy when enrolling through Maryland Health Connect. And then the employer or a broker will educate the employee on the existing individual plans or connects them with a broker, or I'm sorry, I already said that. And that broker or employer will explain that, okay, you're qualified for an APTC on the individual plans, and then, or you are also eligible for an additional subsidy based on your income qualifications. So based on those determinations, the broker or the employer will assist the employee with selecting an individual plan with APTC and additional subsidy. Now, upon applying through MHC, the employer will provide that unique code that's associated with that subsidy eligible employer. And then again, this subsidy will be taxable towards the employer, so they will reconcile when they file their taxes. Now, this is a little bit of a different plan, but I think it might have been mentioned before, and these are the advantages and disadvantages of this plan. But I'll just go to the previous slide because we're getting closer to some of the, towards the end of the presentation. So if anyone wants to comment on this.
Yeah, Rob's got his hand up.
Yeah, so I just want to clarify a little bit. I'm sorry to keep returning to the administrative theme, but so you would be looking, I think, with this one to implement an additional change to the 834, kind of like we did for the young adult subsidy. Would that be the concept? So you would create, currently, right, there's an APTC field, there's a young adult subsidy field, and then there would be a small business, whatever we want to call it, additional field, and those would all be separate line items on the 834. Okay.
Yep.
Okay.
All right, so then on to the advantages and disadvantages again. The major advantage to this plan is that there is no impact to APTC or CSRs. And then the employee can combine APTC with the small employer subsidy, which in turn will cover more uninsured individuals. It will expand eligibility criteria so that more small employers can participate. This is more affordable than the traditional small group plans. We've already kind of went over that in the last two options. Individual plans are slightly less costly than the small group plans. So, and then the disadvantages here would be, you know, small businesses would not have, they would just have a little bit of a limit as to using this as their, limited control over what plans are offered. And then it would also present tax implications for the employee. The employee kind of loses on the value adds that exist with the traditional group plans. And then this is also not available outside of open enrollment and special enrollment periods. So this is a biggie here because how do we make sure that individuals can access a plan throughout the year if, you know, there's these requirements around open enrollment and special enrollment periods for individuals.
Stephanie.
Yeah, I just want to ask for a little clarification about that, because I know for my plan through my small employer, there's like one time of the year that I can change plans, and so I can't do it outside of that. But if I were a new employee, I could do it anytime. Just like in the individual market, there's a special enrollment period for a lot of changes in statuses like that. So how is it different, I guess, for the employee than the employer sponsored plans?
I think Glenn had something to say about that.
Or Sandy. Or Sandy.
Yeah, it's when you're in a group policy, I don't know if you were misinformed or what have you, but when a new employee becomes eligible, they set the guidelines of what the waiting period is if they have no health insurance, whether it be immediate, first of the month following 30 days, first of the month following 60 days. or 90 days is the max with the ACA. And then that employee selects their coverage. They cannot change the coverage until the next open enrollment period, which is the date that the policy went into effect. They have 30 days prior, and the carriers will give up the 30-day late enrollment. But there isn't any mid-year for a new hire to change the plan that they select once they're on the policy, the group policy, if that clarifies your question there.
Well, that's what I mean. Like, I can't just change my policy until open enrollment comes back around. So I just don't understand how this disadvantage of it not being available outside of open enrollment and special enrollment is different.
The disadvantage, if someone is hired in June, they couldn't come into this because they could only come in during the November period of open enrollment in the individual exchange. Getting hired is not an event, is not a special event that allows you to have coverage. Is part of that problem.
But okay, but so if we're designing this program, is there an assumption we wouldn't design it in a way that we would open a special enrollment period for that?
Yeah, that's a fair point, Stephanie. I think part of the recommendation around this option could be that there should be an SCP if you are newly eligible for this state subsidy. That could be a recommendation to get at this concern.
Go ahead, Sandy.
Okay, I have a question. I'm not sure I understand the employer's responsibility in this. Because if I'm an individual now and I'm in the individual exchange and I'm working, can I now all of a sudden in January, in open enrollment period next year, tell my employer, file for this because I want to get this extra subsidy? I'm not sure what the employer has to do once we talk about what the requirements are of size and whatever, what the employer's role is going to be in this, because basically it's the individual market that we're marketing and selling.
Right. Sandy, just a quick comment on that. The employer doesn't get away from responsibility for establishing the plan, however. Okay, under ERISA, if this is an offer, then they have the responsibility for compliance of the plan. And that's very difficult when you've got employees that may leave with a subsidy. How do they cancel that subsidy? There are some other issues associated with trying to convince an employer this is a good strategy for them to pursue.
Because I'm not sure what they're going to get out of it at all, except for paperwork.
That's a disadvantage, absolutely.
Go ahead, Glenn.
Yeah, I was just going to say that would be my comment. Unless you offered some kind of special, enrollment election opportunity for any time for these types of policies to add a new employee, I don't see the advantage from an employer standpoint. And frankly, I have an example case that happened where they just happened to renew in January. The former broker didn't show them the individual or didn't want to move them to an individual product. And then he called me 4 months into it and said, hey, I got a new hire I want to add to the plan. Well, they can't because they have individual policies now. So, if we're going to keep it in a small group product and keep it simple, again, we should try to follow rules that on the exchange and off the exchange follow to keep it simple so we all can understand how to implement it and be equally beneficial to the on the exchange and the off the exchange type small group versus individual, because we'll be competing against the individual market again, in a sense. If that made sense.
Stephanie.
Yeah, thanks. So I guess just thinking about this, I always think about things from a legislature perspective. And I think the most attractive thing about option 3 is that you can not be competing with the federal APTCs. You could build a state program that works in tandem with the federal APTCs. And it's kind of hard to walk away from that kind of money, especially given that the enhanced APTCs have been or are expected to be renewed for another 3 years. But there are administrative questions about that. And I work for a small employer. we do offer employer-sponsored plan, but I looked at the individual market when I started working here because I was interested in what the comparisons were, and realizing there was only one plan at the time offered through my employer versus all of the plans on the individual market. I could see that if I was working for a small employer that said, okay, because you work for me, you have access to all of these plans. And because you work for me, you get a special code that gives you a big discount on them. And that's a special perk that we offer here. I would hope that my employer would care about me having health coverage to attract talent, because I think employees care about health coverage in this kind of an environment with a tight labor market and with people more concerned about their health than ever. And this is just me walking through what I think it would be like. But, I get there are a lot of questions about would employers want to take that up? Would they not want to go through the work of helping their employees with that? I'm interested in, hearing what folks think if there are ways to do that, just because I think that if the legislature heard we have a way to make this in a way that would help small employers and use the federal money so our state dollars go further, that would be pretty compelling, but only if it makes logistical sense.
That's a great point. Trina.
So I do want to say that on the advantages side, bullet number 3, that's exactly what I was talking about. I don't know if I made that clear, but having an employee can employee can combine APTC with small employer subsidies, which means fewer state dollars. That's exactly what I was speaking of. Where the employee will be able to combine the APTC with the subsidy. That would be great.
Rob.
Thanks, Rick. I think the other thing that we would need to carefully think through with an option like this, and again, we're just at some of the early stages of consideration right on our end, but if you're creating an incentive structure to shift people between markets, you do have to sit back and think a little bit about the risk pooling impacts, right? So the ACA requires a single index rate. And Maryland has that separated between the individual and small group market, right? There's been quite a bit of long-term stability in terms of the small group market. Obviously there have been, some challenges, and those were somewhat resolved by the creation of the state reinsurance program on the individual side. So I don't have a clear perspective to offer other than, to sort of raise another question that I think we just have to think through the impacts of incentivizing small employers potentially. I recognize we're trying to focus on folks that are uninsured, but I don't know that we can explicitly just focus on that, or maybe that's a specific parameter I guess we can talk through, but making sure that we're not doing anything that could potentially destabilize a market that's currently functioning effectively and in any way siphon out, create risk pooling issues between those markets.
Certainly not something we want to do. Trina.
I just also want to talk about the special election periods, in terms of, I think we should build out something where people will be able to, the existing SEPs include loss of coverage. And so, I would recommend that, losing coverage through an exchange policy and then going to a shop policy, that would allow someone to, that would allow more flexibility in how people can choose what they want. Because, what Stephanie said is true, where the new employee can come in and make choices, but the old employee cannot. And so I don't know if we have any Rotarians on the call, but in the world of Rotary, the mantra is a couple of things. And that is it the truth? Is it fair? And is it beneficial to all? And so, that's something that you know, I think all of us should try to live by. And just, I'm going to close with this. I was in the supermarket the other day, went to the fish department, and I had a complaint. And I went to the customer service center, and I said to the lady, well, that's not fair. And she said, well, nothing is fair. And I think that, you know, as we build out, we do want to make sure that we stick to, is it fair? Is it the truth? And is it beneficial to all? I yield.
Thanks, Trina. I'm not sure that the principles, the four-way test of Rotary applies in the Maryland General Assembly. Let me just say, I don't think it did the 8 years I was there, but it's certainly a noble human goal, if nothing else. Amber, you had your hand up, but it looks like maybe you took it down. So I think we're back to you, John.
Oh, I was just gonna slides here. Oh, John, did you have something to say?
No, that's okay. That's okay.
Okay, I just have a couple more. So this is just a comparison, you know, just a bullet point, some of the highlights that we talked about, just to compare all three options across the board. So, you know, by plan design, either keeping or losing APTC on the employee side, premium cost, again, you know, on or off exchange, what's available. So for option one, you could do option one on both on or off exchange. Option two as well is available on or off exchange, but option three would be only on exchange because of those, because of the tax credit as well as CSR is only available on the individual on exchange. So, again, sorry. Next slide. Again, comparing, you know, the timeline. You know, we estimate that it would take about 12 to 18 months on both option one and option two. It would take far less of an implementation plan for option three. And then, you know, again, we talked about the plan year start. We would need to discuss this further as to whether some of our guidelines are going to change around this. And then the program cost or impact is just yet to be determined. And then my next portion here is just the duration of the
if I may jump in, I think going back to that comparison, I think I would suggest maybe we pause here and just have the group continue the discussion of these three options. If there's any one
Yes,
that they would
Sandy's got his hand up.
yeah, anyone to throw out or keep. I think it'd be good to get more direction.
I see a few hands raised. So yeah.
Go ahead, Sandy.
Okay, I think you have to add a couple other things to compare. One of them is simplicity, and I think option one is the simplest of the two. Option two is very complicated. ICRAs are very hard to explain to employers and all. And option three might be someplace in the middle. But option one is probably the easiest administratively, I think, to do of those three options. So I think that's a thing. And I think maybe there's a category here of benefits to employer and looking at the three different options, because that's who we're trying to recruit and to make sure employers get enough out of it for their effort within it. I think that's something else we have to consider. But I like the summary a lot because it helps sort it out. So I like it a lot. I just think it might need to be a little bit more detailed.
Thank you. I'll definitely add those recommendations.
Also, go back one more slide there, Mimi. Because if one more slide, there we go. Plan design. If option one didn't have a contribution requirement, the employees with the APTC would not lose it. If it was deemed unaffordable because the employer was not making a contribution. So I think that might be a factor in terms of whether the plan design requires a contribution requirement or not. Again, as Glenn pointed out earlier, small group today does not have a contribution requirement. They have participation requirements, which measures whose coverage is where and what's eligible for a waiver or not. Just to point that out.
So I think thank you, John. That is a good point, that could be a potential way to reduce or get around the impact on EPTC eligibility. So maybe if we strip out that employer contribution aspect to the first option, with options 1, 2, or 3, I would say it would be very helpful if we can get a sense of the group on which of these they prefer, because we really need to kind of know this for our going forward modeling efforts. I'm not really hearing much enthusiasm around option 2, I would say. So it seems like options 1 and 3 are the ones that sparked more conversation. And so, 1, appreciate feedback on if that is an accurate sense of the group, and then any feedback from the group on how you would prioritize or rank these options.
Trina.
I think option 3, especially the APTC box, if they qualify, employees can keep APTC. I think that, and please excuse me if I'm wrong, I don't mind being wrong, but I think that would eliminate the competition between employer, the shop and the ACA. I think that would eliminate the competition, because now you have a combination of the two working together.
Go ahead, Stephanie.
I like option 3 for the same reason, but I'm really curious about this idea you had, John, about if you strip out the employer contribution, then maybe folks could still get the APTC on the individual market. Is that just because what goes into the calculation for affordable employer coverage includes an employer contribution minimum, or is it because we're concerned that employers might offer not very good coverage, and that's why people would still be able to get APTCs?
Well, yeah, I don't know that they would still, because it's all determined by their family income, and the 50% contribution, I was assuming, was just an employee contribution. So, but if you may, so what I don't know is if the employer is making an offer that's affordable, they lose. What I do know is they lose the tax credit. If the employer is making an offer and it's unaffordable, they wouldn't lose the tax credit if they maintain their individual plan. Now it comes down to participation. So when could you write that plan? Well, you couldn't write it the 1st of March or September or whatever, because it would have to be a January 1st effective date for the group to be able to waive participation, because otherwise they'd have a 75% participation requirement, or whatever the carrier's participation requirement, if it was in March or June or when, other than January 1st. But if the subsidy program was offered to small employers that meet criteria for January 1st without contribution, individuals that are currently covered by the individual market could continue on the individual market without it impacting the group plan. I believe that's true.
Sandy.
John, I believe, though, if the individual market is a legitimate waiver, they could probably qualify any time of year, because those people that were in the individual market would have a legitimate waiver, and we'd probably still get to the 75% most likely.
Well, Sandy, that's true. And that goes back to a discussion to be had about the validity of waivers. Is coverage under the individual market considered a valid waiver by the carriers? I think we've had some discussions that says, yeah, they'll consider that as a valid waiver. And other carriers say, no, they won't consider that as a valid waiver. Well, so there needs to be some clarification around that point.
Right. I believe we could go to the insurance department and try to make that a requirement to help with this program. And I'll state my belief that I like option 1 best, then option 3, and don't like option 2 at all, because I don't think it would be workable. is
Yeah.
my real problem there.
Yeah, yeah.
Glenn,
Yeah, I was going to agree with Sandy that, option one is definitely the easiest to implement. The third party administrators we already have a robust small group market with 250,000 insured in the small group market. We don't want to disrupt that pool potentially and moving people into the individual market. The individual rates went up 10%, which is the largest increase we've had in a while. And that pool, as it grows, potentially could have more utilization. And I just think to protect both pools, and I know it's difficult to have all the advantages in there. It would be nice if option one could still have the reduction in the deductible, and the tax credit that would be, that the employee is receiving, but the employer offering a small group plan, the way I see it, and I've been doing this for a long time, so 28 years, and I work for the carrier and I've worked as an independent. And I just think that to try to market and sell this product to a business owner and get their attention span to implement it, option one, if we tweak it some ways, some fashion, to try to accommodate as many people as we can that are uninsured, they're going to pick up some other enhancements. Option three would definitely be my other alternative, although there's some things I don't like about the fact that it's not, controlled by the employer and it's individual policies. And we'd have to deal with that situation of eligibility of new hires and things like that. And option two, I definitely did not care for when I read it the first time. So that's my take on it. And it would be nice if we could incorporate it all into one, but that's the best of the three.
Trina.
So option three, it would, option one would give more control to the employer, but it would also require the employer to contribute more money. And so when you talk about small employers who, remember, this is not in their budget. It's okay if a company is starting up and they're including this expense in their original budget, because now as that company's profit increase, that this is already a line item budget. But for companies that are already in existence, who does not have option one in their budget, it's going to be hard. It's all, you all know, it's all about the bottom line. It's all about what companies can afford.
Right.
And so, yes, option one would give more control, but it would also require the employer to contribute more dollars.
Sandy.
Well, I want to go back to that, because if we talk realistically about how much money we're going to be able to give out, if average premium is $550, how much subsidy can we give that ends up making it affordable to an employer? Do we give an employer $400 and make it $150? And they have to, and we'll go back to the 50-50 and say they have to contribute $100? That's not in their budget, and that's still too much money, $100 a month. I don't think we can ever really get there because premiums are so high no matter what. So what we're doing is only a little bit of help in reality. So you have to come down to the realization of how big the pool of money is, and once you start slicing and dicing, you're not going to get a $300 subsidy. You're going to be lucky if you get a $100 subsidy, and $100 isn't going to go that far, especially if should be splitting it proportionally with the employee to help the employer. As much as I want to help them, the dollars really aren't there. Right. It's maybe a design of a whole different plan that takes care of catastrophic stuff and other stuff. And that's all we can really do is force a whole different plan design, not what we're focusing on here. But that's part of the reality in my mind.
Go ahead, Mimi.
Hey, I just wanted to point out as we deliberate on this. The 50% contribution was set there just because the group had said in their surveys that the savings should be passed down to the employee somehow. So maybe that was an avenue by requiring a contribution, but some way of, we should think about some way of it being passed down to the employee, whether it's a contribution or not. We can eliminate the contribution if it causes some other problems down the line. But we have to find a way to incorporate that just because the majority of the group has said we want that passed down. That was all my point. Thank you.
Trina.
And I just want to say, what Neil just stated in the chat box, just want to piggyback on that. We are really facing the Maryland Insurance Administration, and so some of the rules and regulations that we want to put up or design, we really do need to know, the MIA, they have a lot of power in this conversation. And so, my point is that we do want to know what they would allow and what they would not allow.
Jamal.
Hey guys. Yeah, so I think that it's important to just be mindful of the challenges that are already, and I think you all know them, may know them, the challenges that are already presented for small business owners, and it's already difficult and in itself to for many of us to keep our doors open, and we believe 100% that it's kills two birds with one stone to make sure that we have good quality coverage for our employees, because they're happier with us that way. They want to be with us that way. But it doesn't help us if we have to take a hit during the process. We have to find a way or consider an option where specifically now, while things are so difficult and while we're going through so many variants and everything else, and gas prices, and it's challenging. And not only that, but people don't want to work. So I mean, that's another thing that's challenging. So if we're going to do this, we have to find a way to keep the cost in order in such a way that we can afford to manage this process within our four doors. We have to consider affordable health care, affordable for everyone, the employer as well as the employee. Otherwise, it's going to put a strain on us that will be a detriment to the employer-employee relationship. But not only that, as the backbone of the economic of our country, should I say, just the economic aspects of our country, as a backbone of that, as a small business owner, we shouldn't be beat up too bad. It's just going to make it a little more difficult for us to help move this process forward. And I'm 100% an advocate, obviously, of making sure that everyone has health care. But I think there's some revisiting that may have to be done. So thank you. Thanks for hearing me out.
Trina, you have something to add?
Just in terms of actuarial numbers, just want to remind the group that we have a solid set of actuarial numbers in terms of, the individual market. And so, all carriers, they know, what costs what. Glenn mentioned earlier how premiums have gone up 10%. So my question is, what is the why? Why did it go up? Was it because of the pandemic drove up costs? Is it because the carrier wants to make more money? So we, that increase in premium costs, we really don't know why. We don't know the why. And maybe we should know the why. Because if we know the why of the premium increase, then that will help us design a better group product.
I don't know that in the time frame we have to work in, we can get that answer though, or those answers. It's multiple answers.
I thought there was someone on the work group from the insurance administration. Is that true or not true?
Yes, I think we have Henry from the MIA on. I will say just, at a high level from what I've talked to the MIA about and seen in rate filings and discussions with carriers that, we're seeing premium increases proposed due to the impact of inflation, due to some increased utilization as we're coming out of the pandemic. I think those are kind of the two big impacts that are driving up those proposed increases. Increases, I'll remind folks, haven't been finalized. The MIA is still reviewing those, and so we won't know what the final rate increases are for 2023 until probably early next month.
Yes, that's correct. We're working on it now, training, and we can answer some of those questions for you.
I want to remind everybody that we're on a timeline and we do have an obligation for public comment, but Mimi, I didn't know if you wanted to get into the timeline.
Yeah,
or...
I just have one slide on this. It's the subsidy timeline consideration. And again, we talked about this earlier, but somewhere around 18 to 24 months is what we think it would take. But we could also say, timeline could be suggested by the available funding, and we can break it down like as an example in this table below. A 12-month program could cost, 30 million. This is all just numbers we're estimating, and it could impact about 4,000, for example, or 8,000 at 60 million for 2 years. We could just break it down like this, but we should think about the timeline and the cost, especially that's going to be like the next deliberation, I think, at the next meeting.
And I'll just say here, I think we've heard, some robust conversation around the concerns with the time limit, thoughts around phase out. We'll kind of take that into consideration as we talk to John and Rick about some more specific options to mock up and cost out for the group. So we'll see that next meeting.
Yeah, and we can include like a phase out period and, based on the group suggestion, when we say 18 to 24 months, it's not to say it's just going to flat out end at 24 months. We could implement some type of phase out or soft landing for the businesses as well.
Mm-hmm.
We're looking at next steps. Again, we talked about this as, determining and ruling the eligibility criteria, and then, having some possible impact with dollars available, and detailing some scenarios on how far the funds could stretch with no criteria, and limiting it to employer size, average wage. And this comes directly from your feedback as well.
So if I could be so bold, we have the two options that we seem to be grappling with, options 1 and 3. We all have access to that. Those slides that have those options and sort of the component pieces. Instead of taking time in the next 7 minutes to discuss them, is it feasible, Mimi, Johanna, and John, to have folks? And so this isn't just an ask like we did with surveys earlier. This is a demand that if you could take a day or so, all of us, to provide some feedback relative to clarifying options 1 and 3. And do that in writing via email, working off the slide deck. If we could do that in a day or two, I think that would give the health exchange staff a little bit more time to kind of prepare for the next meeting. So that, John, if you're agreeable, that might be a mandatory homework assignment for everybody.
I think that sounds like a great idea.
So I think we do need to open it up for public comment. Johanna, I'll turn it over to you to do that.
Sure, yes. Do we have any members of the public who would like to make any comments about the conversation today? And we didn't have anyone indicate that if you wanted to comment in advance.
And we still have some people with hands up that we might be able to get to.
Yeah, my intention was to get through all the folks that still have their hands up, but I really wanted to make sure we met our obligation under the Open Meetings Act to solicit input from the public. So Trina, you're up first.
So I just want to state very clearly, as we consider the phase out or the end of the program, I think it would be very helpful to design something so that when the subsidy ends, that employer will know, will have a clear understanding of what options they have. And so I think if we started, tell them in the beginning, look, this is going to last 2 years. After 2 years, X, Y, Z, 1, 2, 3. Those are going to be your options to choose from.
Yeah, I think Sandy made a great point about a phasing component. Stephanie, you had your hand up.
Yeah, just having served on a lot of these work groups, I know that the conversation can move pretty quickly during the meetings themselves, and folks bring such a depth of knowledge that I just want to highlight that there might be folks on the work group that have valuable perspectives, but might not be ready to say them during a work group meeting, or even just write up the email by themselves. And so I'm wondering if the exchange staff might be open to having one-on-one conversations with people, if there are any members of the work group who, just could use a little bit making of guidance on some of the topics discussed before they feel comfortable submitting their opinions.
Absolutely, yeah. If you have questions and you want to have a conversation, feel free to reach out to Mimi and myself, and we're also happy to try to coordinate with John and Rick as their schedules allow, but we can certainly make ourselves available to answer any questions.
Absolutely, yeah.
Jamal, you had your hand up, but was that from before, or do you have something else you wanted to contribute?
That was early.
Okay.
Thank you.
And Sandy.
On your chart before that, you said 4,000 groups. Did you average a certain number of employees? Because it would help me figure out, you think we're going to average 5 people a group, 2 people, what it is when you look at the budget?
That was just a figure that I came up with. I didn't do any real calculations, but I'm sure internally here, we have some resources that we can reach out to get some figures.
Yeah, that was just kind of imaginary data.
Right. I understand, but it would be important to have a number there.
Yeah, I might comment that we have a sample census that was from the original slide deck that had 7 individuals of various ages, and that perhaps could be the model that we use. I think that came up to about $3,600 a month in premium for a $1,500 gold plan. Whether that's the right plan or not, I don't know. But to get to some sort of averages, that's probably a good census to work from. That ranged from a 22-year-old to it didn't have salaries, which may be an important aspect to it. But it ranged from a 22-year-old to, I believe, a 58-year-old or something like that.
Well, what I was trying to do is take the 30 million, divide it by 4,000, divide it by, you say 7, and then you'll come up with what an average subsidy would be to see if that's a reasonable number that will help drive people to buying a small group plan that don't have one now.
And I'll just add, we will work with our contracted actuaries and with MIA to come up with some real numbers for you. We've got data on average premiums in each market, on most popular plans, on enrollment, on the number of uninsured, so we can use some real data to get you some estimates.
That's great.
Trina, you had something?
I just want to jump in. Oftentimes when I look at the numbers on the exchange, that 80/20 gold, those numbers, when I price out individual policies, the gold policies, it seems as though the carriers are favoring those actuarial numbers, that 80/20 split.
Okay, next steps, public comment, did that. Next meeting, August 23rd. So a week, 2 weeks. And then the appendix has all the slides in from just the factual slides that we had before. So yeah, everybody's feedback, it was a good meeting, a lot of good discussion. I'm sure, like Stephanie said, it's a matter of processing some of this stuff, and you'll think about something, 15 minutes from now that may be germane to the conversation, and we want that feedback from you so that we can consider all those points. This is a real brainstorm kind of an effort from this group, and everybody's comments and participation is greatly appreciated. Thank you. Anything else from staff?
No, thank you all.
Okay, great. Thank you all for being on a call.
Thanks.
Thanks. Take care, everybody.
Have a great
Thanks,
day.
everyone.